Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. A couple of weeks ago, regarding the World Hepatitis Day, we organized a national symposium on fatty liver disease. And in this symposium, there were excellent sessions on faculty discussion on the different aspects of fatty liver disease. So in this vlog, I would like to share with you the important questions and the discussion points which were raised and answered in the faculty discussion in this symposium of the fatty liver disease. I hope you will find it useful for your everyday clinical practice while diagnosing the patients with fatty liver disease and treating the patients with fatty liver disease. Bismillah ar-Rahman ar-Rahim. The theme of the symposium was reversing the trend, advances in fatty liver disease therapy. There were 8 lectures in this symposium, and I arranged the faculty discussions with relevance to those 8 lectures so you easily get the rationale or get the theme behind these faculty discussions. The first lecture was on the burden of MASLD and MASH, the epidemiology and natural history. And after this lecture, the questions which were asked and answered by the faculty, the question asked was, what are the most alarming trends in global epidemiology of MASLD and MASH? And the answer to this question was, the global prevalence of MASLD is approaching 30%, with South Asia seeing rapid increases due to lifestyle shifts, obesity, and diabetes. The rise in children and young adults is particularly concerning. Another question asked by the audience was, how does the natural history of MASLD or MASH support early screening strategies? And the answer to this question was, since MASLD can progress silently to MASH fibrosis, cirrhosis, or even HCC, early identification in at-risk group, that is diabetes, patient with diabetes and obese individuals, is crucial to prevent irreversible liver damage. The second lecture title was Diagnostic Advances, Non-Invasive Assessment of Fatty Liver. And the question asked from the faculty was, which non-invasive modalities are now preferred for assessing fibrosis in MASLD patients? And the answer was FibroScan, transient elastography, FIB4 score, and ELF tests are widely used. They reduce dependence on liver biopsy and help stratify risk in primary and specialist setting. Another question asked regarding this lecture was, what are the limitations of current non-invasive tools in diagnosing MASH specifically? And the answer was, most tools detect fibrosis but cannot confirm inflammation and ballooning seen in MASH. Therefore, non-invasive tools are useful for ruling out advanced fibrosis, but biopsy remains the gold standard for definitive MASH diagnosis. The third lecture title was Clinical Dilemmas in Management of MASH. And the question asked from the faculty was, what are the key challenges clinicians face when treating MASH in diabetic patients? And the answer was, overlapping comorbidities like insulin resistance, cardiovascular risk, and drug interactions make therapeutic choices complex. Tailoring treatment to individual metabolic profiles is essential. The second question asked was, how do we approach patients with discordant biopsy and imaging findings? And the answer to this question was, multidisciplinary discussion is key. Repeat biopsy or advanced imaging may be warranted. Also, clinical context and longitudinal monitoring guide treatment other than a single data point. Then the next lecture was on lifestyle and nutritional interventions for MASLD patients' evidence-based practice. And the question asked regarding this lecture was, what is the minimum weight reduction required to impact liver histology in MASLD? And the answer was 7 to 10% reduction in body weight has shown improvements in steatosis, inflammation, and even fibrosis in clinical studies. The next question, how do we address patient adherence to lifestyle interventions in real-world settings? And the answer was patient education, culturally relevant diet plans, family involvement, digital health tools, and motivational interweaving techniques improve long-term adherence. The next question was emerging pharmacological therapies, spotlight on semaglutide and resmetirom and beyond. The question asked on this lecture was, what is the mechanism by which semaglutide benefits MASH patients? And the answer given was, semaglutide, a GLP-1 receptor agonist, improves insulin sensitivity, promotes weight loss, and reduces hepatic fat and inflammation. And these are the key components in MASH pathology. So semaglutide acts on these mechanisms. The second question regarding this lecture was, where does resmetirom stand in the therapeutic landscape of MASH? And the answer, resmetirom, a thyroid hormone receptor beta agonist, has shown promising results in reducing liver fat and improving histological features of MASH. It represents a novel targeted therapy under advanced clinical investigation. Then the next lecture was MASLD in lean individuals, rethinking risk beyond obesity. And the question asked about this lecture was, how do lean MASLD patients differ from obese patients in terms of risk profile? And the answer given by the faculty, lean patients may have underlying metabolic dysfunction, genetic predispositions, that is PLA3, and gut microbiota changes. Despite lower BMI, they still face fibrosis progression and cardiovascular risk. The next question asked was, what are the diagnostic pitfalls in lean MASLD? And the answer was, it is often underdiagnosed due to absence of obesity. Physicians must maintain a high index of suspicion in lean individuals with metabolic syndrome features or unexplained liver enzyme elevations. Then the next lecture was on liver-heart diabetes triangle. And the question asked about this lecture was, why is fatty liver now considered a cardiometabolic condition rather than just a liver disease? So the answer was, MASLD shares pathophysiological pathways with cardiovascular disease and diabetes. It increases the risk of heart failure, atherosclerosis, and mortality independent of liver fibrosis. Another question on this lecture was, should MASLD screening be incorporated into diabetics and cardiovascular disease care algorithms? The answer was yes. Guidelines now recommend routine assessment of liver health in diabetic and obese patients due to shared risk and potential of early intervention. The next lecture was real-world experience and future directions in MASLD MASH management. And the question on this lecture was, what real-world barriers hinder effective MASLD management in Pakistan? Answer given was limited awareness, lack of structured screening, patients' non-compliance, and resource constraints make guideline-based management difficult. Health system integration is needed. The next question on this lecture was, what promising future directions could reshape MASLD therapy? And the answer was combination therapies, personalized medicine based on genetic molecular profiling, and public health policies focusing on prevention will be key in such scenario. Then the last lecture was that on the MASH and colorectal surgery, perioperative risks and outcomes in metabolic syndrome era. The first question asked on this was, how does MASLD MASH influence peroperative risk in colorectal surgery? And the answer was, patients with advanced MASLD or MASH have higher risk of hepatic decompensation, poor wound healing, and cardiovascular events. Preoperative liver assessment is essential. And the next question asked on this lecture was, what modifications are needed in perioperative care for MASLD patients? And the answer given was optimization of metabolic comorbidities, nutritional support, careful fluid management, and collaboration between hepatologists and surgeons improve the outcomes. So, dear viewers, these were the most important questions and answers in the faculty discussion in this symposium. I selected two most important questions and their answers asked after each and every lecture. And I hope this will help you out in making appropriate decisions and in-time decisions about your patients of fatty liver disease in your clinical practice. Inshallah, in next vlog, I'll select one another symposium and their lectures and their faculty discussions in the hope that these discussions, whatever the pearls we hear, we learn, these will help you out in your clinical practice. So take care. Till then, Khuda Hafiz.